Hi, Dr. Bill Hanage. How are you and who are you? What do you do?
I am an associate professor of epidemiology at the Harvard T.H. Chan School of Public Health, and I work in the Center for Communicable Disease Dynamics.
And what do you think is missing from the conversation around COVID coronavirus 19 in the UK?
I fear that the UK has got caught into this very deeply unhelpful partisan divide, which maps onto partisan divides, which I think you know a lot about, and which is essentially struggling to be able to maintain both a sensible long-term plan and straightforward scientific risk communication to the public.
Well, my main complaint is the basic principle of we know that lockdown doesn't eliminate the disease or grant herd immunity. Therefore, the only purpose of lockdown is to flatten the curve enough so the NHS can survive and give us enough time to make our economy COVID secure, so that when we open back up, it doesn't cause an immediate spike. That's my thinking.
Yes, and by the way, you have in that articulated probably the clearest understanding of what the actual purpose of shutdowns is from any non-epidemiologist that I have heard.
Thank you.
It's incredible. You know, the point is not to shut things down, hunker down, wait for it to pass. That's not the way it works. It doesn't pass, provided there are people among you who are susceptible, and there are. I mean, lots. Um, you are what you're doing with the shutdown is you are preventing the worst outcome, which is real damage to healthcare and a huge amount of excess deaths.
Yeah.
And by the way, can we please stop talking about things like the NHS collapsing or not collapsing, what have you? Because places, healthcare starts getting damaged when it stops being able to do all of those important primary functions. Stuff like, routine care, routine checkups. We are seeing, patients with forms of cancer now that we would never have seen before, because of the fact that for a long period of time they weren't able to have chemotherapy. And why were they not able to have chemotherapy? Because of the virus, not because of the shutdown, because the virus made that amount of shutdown necessary. And we have to be able to take that, and then we need to be able to make use of it to, like you said, COVID proof the economy. You're not going to be able to make it normal. You will be able to make it more comfortable, and to prepare for testing and prepare for the entirely predictable things that are going to happen at the point when you allow more opportunities for the virus to transmit. So, I mean, the way that I tend to think about it is more like pandemic management, which I wish we could get our head around pandemic management rather than reopening, because I think we like reopening contains within it this little subtle lie, which
Yeah.
is saying
Get
we
back
can
to
be,
normal.
yeah,
Yeah.
normal, bing. But what we've got instead is this unfortunate sort of, I mean, infantilization of it, in which we have very extreme views, and that's one of the reasons why I thought it'd be interesting to talk, because you have some experience of extreme views.
A little.
Let's take, for instance, schools. There appears to be a strange division in society between either schools must be completely open under all circumstances or completely remote under all circumstances. And that's just nonsense. And we have seen there's very, very good evidence from plenty of countries that have been attempting to do in-person education. Um, and like Denmark, for instance, has had a relatively successful experience.
What are they doing there?
Um, they shrank class sizes. They had PPE, hand sanitizer, stuff like that. One thing they did, which was really interesting, was that they used parks, public parks.
One thing that's
Um,
confused me is the idea that we haven't, to some extent, I know this is possibly, you could argue this is draconian, but taken advantage of spaces that aren't able to open yet to hold classes, for example.
yeah, I don't understand that either. I have made similar suggestions. I mean, uh, I'm not actually joking
Mm.
when I point out that those nightclubs that are forced to be closed,
That was my thought.
that's a space. And I don't think that it's draconian to do that. I think it's taking the problems of one sector and solving them with the problems of another sector.
Yeah.
And that kind of, it's that sort of imaginative response that has been lacking in too many places. But the thing which blows me away thinking of schools is that instantly um, instantly the gentleman who resides in the Oval Office who has trouble avoiding tweeting starts getting his fingers busy with his iPhone. If he just says something like, "Oh, in school, in-person education must happen," suddenly this country divides instantaneously into these two completely opposed camps. And the fact is, there is actually a scientific reality and a reality in terms of risk and how things can be done safely, which are entirely independent of what he says. But it becomes more difficult to talk about them because things have become so intensely polarized. And I feel like it just occurred to me while I was talking to you about something else, that you have had a similar experience.
Well, it's on my end. What you're referring to is the problem we had from the start. The idea that the referendum was framed as binary, leave and remain, as if there was only one type of relationship with the EU and another type of relationship. Not that it was going to be some sort of treaty that would be hundreds of pages long, and that it would be highly complicated, and there were many variables in play. And that it's not one or the other. There are many options to go for, but everybody immediately jumped into their own separate camps. And as a result, the conversation has been, let's say, tricky over the past 4 years.
Yeah.
And so I'm imagining you're experiencing the same thing on your end of things with, you've got your anti-maskers on one side and the anti-vaxxers and the people that say we should have full lockdown, people that say we should have no lockdown, that we should be like Sweden, and then you've got very few that are in the middle, or at least not people that make the news because that aren't able to get their voice out because the people that scream the loudest are the ones screaming for the extremes. Am I right?
Yeah, I think that's entirely correct. I mean, what I personally try to do is I try to call it like I see it. I try to be transparent when there is something that I don't know the answer to. I try to be careful to distinguish between absence of evidence and evidence of absence, which is really important in terms of in terms of a lot of this.
And give an example where that principle applies.
So a really good example of that is aerosol transmission. So people often get up in arms about aerosol transmission, and I have seen newspaper science reporters absolutely vilified on social media for writing, fairly cool-headed scientific articles about it, whether it happens or doesn't happen. I mean, so the problem with that is that it's rather like the sort of mantra that you would get quite early on in particular, that the majority of this is household transmission. Well, a lot of that came from the joint WHO China mission to Wuhan, at which point people were confined to their households. So, okay. So the opportunities for non-household transmission, I'd say the least limited. So we have the situation where, because we are not actually able to directly observe transmission, and we cannot sort of ride on the particles which are coming from the infected person's mouth and being inhaled by the person they're about to infect to see exactly which they do, then we don't actually know. What we can say, though, is that some aerosol transmission definitely occurs. Some. But whether or not it's enough to make a big difference, or is just implicated in some of the more rare, particularly large super spreading events, which I kind of think it's very hard to explain those without some recourse to aerosol transmission. We don't know. So we have a situation there where there's an absence of evidence for the precise amount of aerosol transmission. That is not evidence that aerosol transmission does not ever occur. Do you think it does a bit? I think I've got an even better one for you. Absence of evidence is not evidence of absence. And this is extremely well illustrated by the questions of infection in children. So the younger age groups are much, much less likely to show symptoms, get severe disease, indeed. I mean, this is one of the arguments for why schools should be open. I mean, the risk to children of an outbreak in them is not very high at all. Um, but that has also led people to say that they don't transmit. And it's really hard to know the answer to that, because if you're defining like the index case in something that you're investigating by someone who had symptoms, well, children are less likely to have symptoms. So, kid can, and remember, schools have been closed, so opportunities for kids to pick it up have been pretty limited. So, child comes into house with symptoms, infects parent. Parent develops symptoms, gets a test. Ooh, they do an investigation. They find that the kid is infected, and they say, the adult must have infected the child. And it could be even worse than that. And it could be even worse than that, because tests are less sensitive and you're more likely to get a false negative as time goes on in the infection. Child comes into the house, minimally asymptomatic, infects parent. Bit later, parent develops symptoms, gets tested, positive test. Ooh, investigate, test the child. The child is by now too late on in the course of infection to receive a positive test. And then they think, the child is actually resistant to transmission. Then less likely to be infected. So you can see quite easily how all of these, so when we say things about, there is no evidence of transmission in children, well, the actual answer is that there is very poor evidence of transmission in children, one way or the other.
A similar thing that made me think about it, the fact that absence of evidence does not equal evidence of absence, is the thing that Tim Martin said about pubs at the start of the pandemic. He said that there's no evidence that there's transmission happening in pubs, and that he used that to suggest that pubs should stay open.
Well, at what point do you have to start suggesting that there's the kind of the magic pub barrier that happens that when you have a pint in your hand, there's actually a force field all the way around you, which is capturing the virus and wrestling it to the ground to ensure that nobody gets infected.
Look, Doctor, I don't think you understand that Wetherspoons is magic.
I'm going to put this into my next modelling thing.
Please do.
The magic Wetherspoons.
Alert the media.
I sometimes talk about the Thursday fallacy. I talk about this when I teach in my class, and saying that if you're critiquing a piece of science, you should never take the critique where they say, this is all very well, but the authors have not shown that it occurs on a Thursday. They need to repeat the experiments on a Thursday to make sure that it is valid then. Now, you have to ask, why would it be different? What's special about a Thursday that would make it different? In the same way, what is different about a pub that would magically... What makes Wetherspoons magic? Once you've figured that out, then, well, I think if you can show that, then I think you deserve a Nobel Prize.
I'll get right on that. But
again, this comes back to the partisanship, because partisans don't care about that. It's also like, I'm an Arsenal fan, and many times I have stood, when I used to have a season ticket, I've stood and sung, we are by far the greatest team the world has ever seen, and I obviously hold that to be true, but objectively, supporters of other clubs might disagree. And I remember, and I think my wife saying to me at some point, like, why do you sing that when Man United are winning the league? And I just said, well, they're only the greatest football team if you're like taking that very limited measure of the number of games that they've won. If you consider the other measures of what the greatest team, then I think Arsenal comes out on top. But that again is a statement of the partisan. But in a thing where it's like supporting a football club, then it's not without negative consequences, but they're relatively small in comparison to people being out of work for 6 months.
This idea of a mountain of evidence against a partisan belief that people don't ever go back on regardless of what they're shown is completely new to me.
That it is. Yeah, you cannot reason people out of a position that they didn't reason themselves into. We're not talking about folks who are just doing this because they're not smart. We're talking about folks who are perfectly normal, good human beings who have been caught in this lock of partisanship, which has divided both the United States and the United Kingdom. And it's difficult because it means that they find it hard to view their fellow citizens as being rightful citizens. This is populism, And it happens if you're talking about the response to Brexit or if you're talking about how you handle a pandemic. Marina Hyde made some comment that the more extreme end of the Remainer Brigade at least gave you a sense of what would happen if the entirety of Henman Hill suddenly took crystal meth. And there's a real element of truth to that. But one thing I noticed about the British situation, which I think is really quite disturbing, is that scientists have, politicians say we are being led by the science. It's not true. You're being led by the politicians. The politicians know where they want to go, or they have some sense of where they want to go, even if they're not telling you. And then the scientists are coming in and saying, well, if you do that, we think this will happen. And the politicians then have to kind of weigh that and go, okay, I'm okay with that. Or I'm not okay with that. And then they make a decision on the basis of that. And over time, the scientific evidence will likely shift. It's like I've become more convinced about the amount of aerosol transmission that goes on over the course of this. But, our evidence changes. And sometimes, you can always trust a scientist who sometimes says, oh, I don't know. Good question. Because that's, you don't have the answers to everything. That's the whole point. We don't have the answers to everything. Yeah. You should also be aware, and I think Ben Goldacre said something like this a long time ago, but you can find, there is no proposition out there that is so outlandish or crazy or without any actual support that you cannot find at least one person with doctor in front of their name prepared to testify to it. The body of evidence that we have is continuously growing and changing. And so you can think of some people who might take very, very, very outlying things, but the mass of belief and expert opinion is somewhere in the middle. And it may shift over time, but taking the temperature with a bunch of people should give you a pretty good sense of what the reality is. And you can see this with climate modeling. There's a pretty large consensus that climate change is anthropogenic, made by humans, and that it's going to be serious. Similarly, there's a pretty large consensus. I mean, it's almost complete. I can only think of like less than a handful of people who would disagree that unmitigated outbreaks are disastrous. Even Sweden has, Sweden banned large gatherings quite early on. Probably one of the best things they did. And you cannot take, you cannot take outliers as being representative of the whole. Unfortunately, I feel this has been happening quite a lot in the UK recently.
Well, I mean, I know the idea of saying you're following the science, but choosing which scientist to go for. I think the best example of that is probably Donald Trump, who relied on the doctor who said that you can get pregnant via astral projection in your dreams. I think that was the essentially witch doctor that he relied upon.
He has. That is, probably the worst example. I'm not sure that the president would take her opinion on everything, or at least I hope not. But yeah, what he's actually got at the moment is he does have real professionals around him, like Tony Fauci. But he's also recruited Scott Atlas from Stanford, who has, again, not really any infectious disease experience. Largely, it seems, on the basis of the fact that he says what he wants to hear. The UK government at the moment has got a completely disastrous testing situation.
Yeah.
The first thing about testing is that it's true that if you have a very large outbreak, then running tests is kind of a waste of time because of the fact that if you have a person with those symptoms, then, well, you can be pretty sure that they have it and you treat them accordingly.
Yeah.
And then what you really need to use the tests for is to ensure that people who are in hospital receiving care receive the appropriate care. There's another cause for tests, though, which is to, when cases are rare, to do this sort of situational awareness, to know what's going on so that you're able to take action to prevent spikes before they either happen or before they become worse.
natural testing is really useful in the community.
And that's where you are right now, because as you know, it's not that masks necessarily stop you being infected, but it makes, it decreases the chance that you infect somebody else.
Exactly.
Exactly. It's the thing which makes it sort of a no-brainer is that all of our talk about shutdowns and so on and so forth are because we're trying to increase social distancing. We're trying to say everybody should assume that they are infectious and treat themselves accordingly in order to avoid infecting someone new. Well, masks help with that. Masks do that, and they make it easier to do that. And if I'm talking to you in person, we can do it for longer with reducing the risk of transmission. And the goal is also, we cannot eliminate all transmission events.
It's about reducing risk and managing risk.
Exactly. We can reduce and manage risk. And if we do that well enough, if we get to the point where we have a sort of steady stream of infections of an amount that is considered to be tolerable and continuous, well, that's a situation which you'd be probably wanting to hold on to, right? And not disrupting. And through that, at a particular rate, you will gain some naturally acquired population immunity, but you're not going to gain naturally acquired population immunity in an uncontrolled way. Look at Sweden. Sweden is seeing a consistent amount of cases. So you cannot basically say that Sweden is an example of how herd immunity works, because Sweden is still having a consistent flow of cases. Sweden might have advantages in other ways. I mean, my views are actually pretty nuanced. The thing about it is that, as has been very, very clearly stated, the real disaster was that the infection found its way into nursing homes, as it did in the UK, as it did in New York City.
This is the thing about how those who argue for let's let the virus rip through and protect the vulnerable doesn't work, because we tried that in March and it still reached the nursing homes anyway.
And you know what? There are quite a lot of people in those age groups in the United States and in the United Kingdom, and they're not all in nursing homes. And it's going to be truly difficult to protect all of them. I mean, I think you can do it better than you did. I mean, we could scarcely do worse. I understand that for a lot of people, this is overwhelming. I mean, it is a huge personal public health threat. It's a huge economic threat. And, I do care about the economy. Like you said, we should work to COVID-proof the economy. We shouldn't just pretend it's not there. But that's a crucial thing. Once you stop pretending it's not there, once you accept that it's bad, you can start to see and appreciate all the things that people are doing to make it better. And that is actually inspirational when you start thinking about it. There are so many people doing so many things which are both large and small scales, largely independently of our governments, but they're doing stuff to try and make things better. And I personally find that inspirational.
Thank you.
And I hope there'll be more of them.
I appreciate that. Thank you very much for talking to me, Dr. Bill Hanage.
Thank you. And, also, I sincerely mean this, by the way. You did help me through Brexit.
I appreciate that.